This episode is brought to you by Therapynotes, therapynotes.com, and also Michael Hyatt and Company's Full Focus Planner. You can check it out at practiceoftherapy.com/full focus planner. This is the Practice of Therapy podcast with Gordon Brewer, helping you to navigate your private practice journey. This is session number 167 of the Practice of Therapy podcast. Hello, my friends. I'm Gordon Brewer. Glad you're with me. Glad you're here for this particular episode. And I'm real excited for you to get to hear my guest. She's not a new guest for me. Kasey has been on several previous episodes, so be sure and go back and listen to some of those, one of which was with my interview with Mike Michalowicz, the author of Profit First. And Kasey was the person that introduced me to Profit First. And so when I interviewed Mike Michalowicz, I had to have Kasey do it with me. And that just blossomed for her. And she's going to be talking about the new book that she's written in collaboration with Mike Michalowicz. And so you're going to get to hear more about that and what she's got coming up. So, Kasey is one of those people that's really a systems and processes guru. It's how she has built a multi-million-dollar practice in Kentucky. And you're going to really enjoy listening to Kasey. She's just, again, one of those great people. And I like hanging out with her husband, Trevor, and we'll talk about some of that as well. But anyway, we'll get to Kasey here in just a minute. Before we get to that, though, I'd like to invite you to go over and take a look at the landing page that I created over something that I've really kind of gotten kind of nerdy about, and that is productivity and time management. I've told the story before, but one of the things that I know about myself is I'm not a naturally organized person. And several years ago, when I first started my private practice, I was just really getting overwhelmed with a lot of things, and a lot of things started falling through the cracks. So I really started being kind of a person that really was set out to study how the art of time management and productivity. And I've really learned a lot over the years about that. But one of the systems that I've landed on as a result of that study that I did, the self-study that I did, is the Full Focus Planner. And it's what I use. I've been using it for a few years now. And it's a planner that was created by Michael Hyatt and Company. And it's a bound planner. So it's kind of, some people might consider it old school, but it's really very practical in that it's low tech and that you've got actually pages that you write on. And one of the things about that is that using just good old fashioned pen and paper is that it causes us to process information differently. If you think about it, if you write something out in longhand or just write it out, you have to slow down to do that rather than typing it out or typing it in your phone or whatever. But anyway, I would love for you to learn more about this. And so if you'll go over to practiceoftherapy.com/full focus planner, you'll be able to find out more about that. It's a wonderful tool, and I'm so happy to be an affiliate for the Michael Hyatt and Company around their whole line of products around the Full Focus system. And they've got a book that is called Free to Focus that is really one of those game-changing kind of books around time management and productivity. So if you're getting frustrated with feeling unorganized and feeling overwhelmed with all the stuff that's being handed to you all the time, I would invite you to go over and take a look at that. Again, if you'll go to practiceoftherapy.com/full focus planner, I've got that landing page set up so you can learn more about that system. So be sure and check it out. The other thing I want to let you know about is that, as I've mentioned in other episodes, I'm working on the updates to the Google Workspace for Therapists course that I created. It used to be known as G Suite for Therapists, but Google changed their branding. And so I'm updating the course to match their branding. But also, I've just learned a lot of new hacks and ways that you can use Google Workspace in your practice to really, again, help you with your productivity and creating a platform within your practice that you can do most everything that you need to do as a private practice owner. It doesn't necessarily replace an electronic health record system like Therapynotes, but one of the things about it is you can do your email, you can track things, you can create the session note helper. All of those things are things that you can create within the Google Workspace and make it all HIPAA compliant and HIPAA secure. So be sure and check that out. For right now, it's still at the original price. It's just $98 for the full course, and it's about 6 hours of instruction. And I just go through all the different tools. And once I get everything updated, it's an online course. But the updates are coming live. So if you buy the course now, enroll in the course now, you'll get the updates as they come. But once I get all the updates in place, I'm going to go up in price. So take advantage of that. And you can simply get to, it's still under the old URL, just practiceoftherapy.com/G Suite course. And you can find out more about that. Again, practiceoftherapy.com/G Suite course. So be sure and check that out. And before we get to Kasey, I'd like to invite you to take a look at our sponsor, Therapynotes, therapynotes.com. They are the leading electronic health record system for mental health providers in private practice. They're who I use in my practice. They have a patient portal that is second to none. Their support is just phenomenal. And also, they now have telehealth that is included in their package. So be sure and check it out. And if you'll use the coupon code Gordon, just GORDON, you can get 2 months of their services. You can try them out for 2 months at no cost to you. So anyway, be sure and check it out, therapynotes.com. And I think you'll be pleased with what they have to offer. So without further ado, here's my good friend, Kasey Compton, and I'm so excited for you to get to hear from Kasey again. Well, hello, everyone, and welcome to the podcast again. And I am so thrilled to get my old friend, Kasey Compton, back here on the podcast. And we were just talking before we started recording. We just waited too long to get back together. We're practically neighbors. She just lives literally over the mountain from me, only about 2 hours away. And I just love hanging out with Kasey and her husband, Trevor, and all of their clan up there in Kentucky. And so, Kasey, welcome.
Thank you so much. I'm so excited. It feels like it's been forever since it has been forever since I've seen you in person, and it feels like even more forever since I've seen you on a podcast. So I'm happy to be here.
Yeah. And just Kasey is one of those rock stars just in this space of one of the people that has really taken kind of her dream of owning her own business, owning her own practice, and just expanded it and expounded it and all of that. And she is a master. Kind of her superpower is knowing how to put systems and processes together to make things work and run like clockwork. And I'm sure we'll talk about that a little bit. But Kasey, for those that don't know about you, why don't you tell folks a little more about your private practice journey and kind of how you've landed where you've landed?
Sure. So I started this back, I guess it all really began back in graduate school. I was a teacher and went into graduate school to get my master's, and I knew I didn't want to teach anymore. So I thought counseling would be the next phase of my professional journey. And so that's what I did, and went into that program knowing that I wanted to own a business too, because that was something that was always very exciting to me. I guess just because of the creative side of me loves to create new things. And so I did that back in 2015. I started my group practice. It was just me in the beginning, and I always knew that I wanted to add more people, but started with myself just to kind of develop some processes and start to build out some systems to make it easier whenever I brought more clinicians on. And we just took off, and really just kind of doubled in size year after year. And we've kind of leveled out a little bit now, and we have 9 locations. We own 2 of our commercial properties. We're getting ready to purchase a third. We are in about 19 counties across the state of Kentucky. We have about 80 employees at the moment. We're hiring for about, I would say, about 40 more.
Wow.
Yeah, so it's been a fun ride. It's the group practice business for me has been a blessing. It's been a fun journey.
Yeah, yeah, and it's just I've always wanted to get inside your head, Kasey, in terms of just understanding how you develop your processes and systems and kind of your thinking about that. But I know that you've got a new book coming out, and I know that is something that's real exciting. And you were sharing with me there's going to be a follow up to that. But tell folks about your book, and I know that the book's going to be my window into kind of how you think about things, I'm sure.
It is. It is. This book is so I went into this whole process. Of course, loved Mike, and I have a lot of gratitude toward you for that, because I remember the day you said, "Hey, I'm going to have Mike McAllowitz on a podcast. Do you want to join?" Yes. Um,
Mhm.
yes, I want to join. And so that was kind of the first interaction that I ever had on more of a personal level with him, aside from reading his books. And so, had followed all of his books, implemented a lot of the things that he taught. And so when Fix This Next came out, I just I read the what little I had of it in the beginning, and it was based on Maslow's hierarchy of needs, and essentially saying, you know, our practices have tons of needs, and we can't act like a firefighter every time it has a problem. We actually have to have a system for addressing the problems rather than just willy-nilly shoot from the hip type of to-do lists, post-it note strategies. And so when I read that, I just thought, okay, this was meant for mental health. Like, we have to have this book for mental health. And then after talking to so many other practice owners, and they loved the book, but they said, I just don't know how to apply this to my own business. They could see it a little bit, but they just couldn't figure it out. And so after a lot of thinking and a lot of conversations with Mike and his team, I just knew that it was just something I had to do. Like, I felt like I had a responsibility to write this book. And I did, and I've really enjoyed the journey. It's unique. I mean, I read a lot of business books, and I've never read one like this.
Uh-huh.
It's got definitely a lot of content and a lot of teaching and a lot of strategies and implementation pieces, but it's all done through stories, and it's all done
Mhm.
through stories of my grandpa cleaning out the gutters on his house back, when I was 10, and just these little Southern stories that are
Yes.
helping people understand and business better. And so I can't wait for people to read it.
Oh yeah, I can't wait to. Yeah, I'm excited. I wish I could just get it right now. So, but here, yeah, something that I was just reminiscing, just thinking about um, how Kasey and I kind of connected, and it was over. You were the person, Kasey, that introduced me to Profit First. In other words, I going way back in this, I can't even think how many years now. You had been on a podcast with Joe Sanok
Yep.
just talking about how you had built your practice, and you mentioned profit first. And so I probably that day went out and bought a copy of it, and it just blew my mind. And then, um, I reached out. I thought, well, what the heck? It won't, I really wasn't expecting any results. Reached out to Mike McAllowitz and got a response by email the same within an hour after I sent the email. And I was just kind of intimidated by all of that. And I thought, okay, I know Kasey has got to be in on this interview. So we did that, kind of did it together. And it's still out there. In fact, it's on YouTube, and also you can go back and listen to previous podcasts. But you jump in here, Kasey, because I don't want to steal this from you. But Mike McAllowitz has come out with a few other books. I have not read Fix This Next yet, but I read
Oh,
Clockwork, which was the next book after Profit First.
uh-huh.
But yeah, so I'm feeling a little shame here that I haven't read Fix This Next. So
It is such a good book. It really is. It's such a good book. And if you ask Mike, he would probably tell you, other than Profit First, Profit First was like the book that just claimed his stake in the ground.
mhm,
That just it was unbelievable, amazing book. But Fix This Next, I don't know what he'll say about his newest book, Coming Different is Better, but I know that right now, as far as his books that have been published, he would probably say that this is his favorite.
mm,
Um, and he'll also say that this is the one you should read first
wow.
before any of the other ones.
Uh-huh.
So yeah, I think it's a great book, and he you just have to read it. I mean, it's just
Okay.
hard to explain. And I love Profit First. If I would not be where I am today if it weren't for that book. And I think a lot of people can say the same thing. And I
Mhm.
really truly believe that if people embrace this Fix This Next system, just like they do with Profit First, it will be a game changer for so many people and their sanity and their time. And as well as I do, that's something that time is the one thing we can't get back. There's
Right.
no way you can't make more of it. It's not like money, it just is what it is. And so I think that this book in many ways just we have a responsibility to help people feel confident in the way that they're spending their time and feel like they don't need an MBA to run a therapy practice. And that's kind of one of the running themes throughout my book, is that therapists, in my opinion, are better suited business owners than anybody else out there.
Mhm.
And I truly believe that our businesses are much like a patient. And if we just treat our businesses like we treat our patients, then everything becomes much easier and everything becomes much more efficient, and we have better outcomes. And so that's what I teach in the Fix
Mhm.
This Next for healthcare, is how to treat your business like you do your patients.
Right, right. Yeah, I think, and I'm so excited for this to come out. And I know one of the things that you've been doing a lot of, Kasey, is doing some consulting with other therapists and really helping people kind of build their businesses, and really just kind of teaching what you do in your own practice that has become so successful. And I know we were talking before we started recording that you're starting to, with this whole COVID pandemic that we've been through or going through, as we're recording this, you're just seeing a lot of themes from people about really not knowing where to focus their efforts.
Mm-hmm.
And so,
Yeah.
you want to say something about all of that?
Yeah. So one of the strategies that we teach within this book is how to assess your business. Basically, just like you would do a diagnostic assessment of a client or a patient, how to assess the business in the same way. And there are three foundational levels in your business, which are sales, profit, and order. And we have core needs within each of those levels. And so we ask ourselves, there's 5 core needs in each level. So we ask ourselves the 15 questions. We answer yes or no. And then based on that simple assessment, we're able to determine what our business's biggest priority is and where we should start. Think about it like this. I don't know how much anxiety treatment you do, but it's all kind of the same. So if you have a client coming in to see you and they're having panic attacks, um, and so what you're going to do first is you're going to gather information. So tell me about these panic attacks. When are they happening? How long do they occur? When did it start? Can you identify any triggers? Like, we're going to ask them all these questions to try to determine what's the
Mm-hmm.
core, like what is the core. So panic and anxiety is a direct result of fear. And so fear is just manifesting itself into anxiety and then ultimately into a panic attack. So rather than, if you were my client coming in for panic attacks, rather than me saying, okay, Gordon, I want you to just breathe when you're having a panic attack. Okay, that's helpful, but that's not going to fix the panic attacks.
Mm-hmm.
What we have to do is identify the fear. We have to identify the fear and treat that. So the way that this system works, it's called the healthcare hierarchy of needs, is the exact same way. It helps you identify the core, so what the fear is. And when you fix the core down here, all of the symptoms that are layered on top of that, a lot of times will just fall down. You don't even have to work on those anymore. They correct
Right.
themselves.
Right.
So that's how we get back our time, and that's how we business better. That's how we
Mm-hmm.
get more confident in our decisions and what we decide to work on.
Right, right. Yeah, and in my small group practice, I know that that is something that we're constantly working on, is trying to get our systems and processes more and more down pat.
Mhm.
And just with just we're a we're an insurance based practice, and a lot of our difficulties with our business are around just the credentialing and the insurance and all of that kind of stuff. And so yeah,
Mhm.
and so that's kind of, as you were describing that, I was wondering, what are our biggest fears in my own practice, and has to do with, okay, getting paid
Mhm. Yeah.
by the insurance companies, and that
Right.
sort of thing, is it, and really kind of whittling down on that. So
Yeah. So if you were going to use the healthcare hierarchy of needs to diagnose your own practice, you're probably going to find a diagnosis in that foundational level, which is sales. And then it will tell you exactly what it is. And then that's exactly where you start. It
hmm
just makes it so much easier and so much more concrete, rather, because we know all these things that we need to do, but how do we really know which one is more important? And
hmm
do we how that can be. It can just be
right.
really overwhelming.
Right, right. It is. It is. So yeah. So with your process, how was it that you kind of? It sounds like you used kind of a lot of what Mike Michalowicz has been teaching
Mhm.
with that, and so the starting place is just to do the questionnaire. Is that correct? You just
Yep.
kind of,
hmm
yeah.
So in Fix This Next that Mike wrote, his is called the business hierarchy of needs. It has 5 levels. Um, the healthcare hierarchy of needs only has 3,
Mm-hmm.
and the questions are a little different. So they're all very specific to healthcare related businesses rather than Mike's, which is just very broadly targeting businesses in general. But
Mm-hmm.
yes, that's always, and he refers to it a lot, and I do too in my book, that this diagnostic assessment tool is really what it becomes your compass. It's not going to
Mm-hmm.
tell you how to fix your problems. That comes later in the book. But the
Mm-hmm.
compass is always going to tell you where you stand and the direction you need to go.
Mm-hmm. Right, right. So as you've been working with others with all of this, what are some of the common problems that you see in practices? I mean, I'm sure a lot of practices run into some of the same problems.
Yeah. One of the biggest problems is going to always come in that foundational level of sales. And it's actually the second core need in that foundational level, which is prospect and provider attraction. So, one of the biggest things that we see is their practice is either going to have too many clients and not enough clinicians, or too many clinicians and not enough clients.
Right.
And so, yeah, so that's a big one. That's a really, that's one that people usually have a diagnosis in. The problem that you mentioned earlier about the credentialing and how we're going to get paid, that's also in that foundational level of sales. And a lot of people struggle with that too. And it is called collecting on commitments. It's in the third and the fourth, collecting and delivering on commitments. And that falls in that area. And so that foundational level of sales is sort of like the bloodline for the practice. It's the creation of cash. It's how, if we don't have that, we can't, we don't even have a business. And so it's really, really important. The second thing that I notice, which works well for me because it's my favorite, is systems. So the third level of the hierarchy of needs is called order. And that is where all of the systemization, systems, processes, and everything comes into play. And we noticed that there was such a huge need there that back in the fall of 2020, we launched, at the time it was called the 30-day deep dive. Now it's called Systemizer School. We have our second group going through it right now. But we noticed that people just struggle with creating lean, creating efficient processes within their practice. And so it's an 8-week program that we created just to help people that are struggling with that area in their practice. And that's huge. That's been a huge one.
Oh, wow. Yeah. That is exciting. So, yeah. So when people are thinking about the systems to have in place for a practice, I know that you're a big proponent of collecting data, of really kind of knowing your numbers well and that sort of thing. If somebody's wanting to get started with that, what's one of the best ways for them to do that?
I love that question. My marketing gal, Emily, she makes fun of me about this because I tell this story about how when my daughters, they're different in age, but their birthdays are really close together. So every year we throw them a birthday party and it's always together. It's just easier. And so we were throwing them a birthday party this past year, and I was looking for the cupcake holder because I forgot to order them a birthday cake. I mean, talk about priorities and to-do list. That one just totally, it slipped my mind. And so I had to go get them some cupcakes at the last minute, and I couldn't find the cupcake stand. And I was like, I don't really want to set these cupcakes in a plastic container and, on the kitchen table. So I couldn't find it, but I knew we had them. And actually I knew we had lots of cupcake stands, and the time was running out and I was getting stressed. And I just lost it. I couldn't find it. So what I did is I took every single thing out of every cabinet in my whole kitchen, just everything, every drawer, every plate, everything. And I threw it in the middle of the kitchen floor. And my daughter walked in and she just, like, her eyes were really big. And she was like, Mommy, what did you do? And then Trevor walks in because he had gone to the store to get some ice cream. He was like, what's going on? And I said, this chaos is killing me. I cannot live this way. I can't stand, when I can't find something and I need it. And then what happens is we just go buy more of what we know we already have, but we can't find it. So it's just easier to go to Walmart and get another one. And then we spend all this extra money, and I just spiraled out of control. And, so after I did that and I threw my little temper tantrum, I left the room and I came back in, and I could hear my daughter, who's 11, saying, okay, let's sort these into piles. Let's put the trash over here. Let's get all of the cooking stuff, like the baking stuff, and let's put it in this pile. And she was kind of telling my husband what to do. And anyway, so they did all that. We got rid of all the stuff we didn't need. We organized the other stuff. We put it in places in the kitchen that made sense. So the things that we used on the stove, we put by the stove, and, simple things like that. And so I would say the exact same thing goes in business. And this is what we do in step 1 of Systemizer School, is we unpack the kitchen. We have to know what all of the current processes are. And the best way to do it is throw them all in the middle of the floor, or just document them on a spreadsheet or something. You just got to start listing them out. And when you can see that mess that you have created, unintentionally right there in front of you. When one single process in your practice takes 42 steps, you will do something about it. You will say, this is not going to work. And so that's the best thing that I could advise anyone to do, is just unpack the kitchen.
Yeah, I love that. I love that analogy of just being able to, it's, I'm sure you've heard of it, a book called Getting Things Done
I
by
haven't.
David Allen. Well, I recommend it. It's,
Okay.
I think you would like it. But it's, he talks about some of the same thing of being able to capture everything, of being able to put, and that's one of the things that uh, people have heard from me all the time. I'm not a naturally organized person. If I were to move the camera much here, you would see that with my desk. I've got the narrow view here, so that kind of gets rid of all the clutter around me. But yeah, but he talks about just kind of the analogy of just getting a big box, and you pull everything out and you put it in the box, and then you do exactly what you said. You go through each item and you decide what to do with it. And
Mm-hmm.
then, so I
Same
love
thing.
that. Yeah, same thing. So I love that. I love that. So yeah, and so yeah, then how do you figure out how to whittle systems down to where they're manageable?
So what we do is, once we have this list
Uh-huh.
of all of the steps, and then the first thing we do is just start reading the list out loud, and then we take the little strike through option on, Word or Google or whatever. And we just start getting rid of the things that we don't want anymore. So we still leave them on
Mm-hmm.
the screen, but we just strike them out. With the big things that we know, these are just obvious things that we don't need. And then what we will do is we'll make ourselves a little legend or a key at the top, and we'll write down bottlenecks. So these are the places that your process stops. We will write down the word congestion points, and this is the places where things slow down. We will also write down platforms. So this will be like EHR, Spruce, Ring Central, all the different platforms you have in the practice. And then lastly, we will write down documents. So this is like a spreadsheet or a form or a list or whatever. And so we'll color code all of these things. And then we start to scan your list, and we will highlight each one of those things that we find in the respective colors. Then what happens is you start to say, oh my gosh, this one process, I have to click through 5 different forms before it ends. This has to pass through 4 different platforms before we finish. And so what we do there is we're saying that all of these changes, all of these bottlenecks, congestion points, platforms, documents, all of that, and the more steps you have, that is more room for error. And so the longer the process and the more that people have to flip flop between different things, the more chances and the more opportunities they have to mess it up.
Right.
And so then what we start to try to do is say, well, okay, what do we not need? And like, what's the point of this? Why do we have this? And is there a way to achieve the same result by not using this
Mm-hmm.
form or this
Right.
document?
Right.
So that's kind of where it starts to become a little bit more of like a problem solving
Mm-hmm.
thing. But basically we identify, so we document all the processes, then we start to streamline it, which is where we cut. And the last piece, the last step is where we automate. And that's where we take what's left and we figure out how we can leverage technology to make things happen on its own.
Right. Oh wow, I love that. I love that because I that just gives me such a visual for thinking about how some of the things I've been working on in my own practice of just being able to streamline our processes a whole
Mhm.
lot more. And one of the things, I don't know if you've run into this concept, Kasey, or not, but I also think about domains. In other words, there are different parts of a business or different parts of what we do, and kind of the two big one that I think about, and I'd be interested to know how you conceptualize this. Got kind of the business side of the business of the practice, and then the clinical side of the practice. and there's some overlap, but for the most part, you want to try to keep those separate to
Mhm.
some degree. But
Mhm.
how do you think about that?
Yeah. So the way that I kind of think about it, as in the term I usually use is just departments. So we'll have the clinical department, we'll have the front office department, which includes receptionist, client care, human resources, all that.
Mm-hmm.
And then we'll have the back office department, which houses the billing and credentialing and all those things. But the way that we have looked at it and that has worked really well for us is just to think that they are all separate in their own way, but they all impact one another.
Mm-hmm.
So if our front office system is not streamlined and efficient, then that's going to negatively impact our clinical system. If our clinical system promises good client care and outcomes and all these things, but then when the clients call, the people that answer the phone aren't getting back to them, or they're dropping the ball, then the client starts to see, they start to think of the clinical system as bad too. Think about if you go to a
Mm-hmm.
doctor's office and you like the doctor, but it's horrible having to go there. Like, you can't get through on the phone. If you need something, the people are rude.
Mm-hmm.
It really taints your perspective of the whole practice. And so we have purposely integrated all of those different departments together in leadership meetings,
Mm-hmm.
because it's important for me to show that if the clinical system isn't doing its job, that's going to impact the billing department, because our clients aren't going to come back to therapy, and then the billing department's not going to have the revenue. If the
Mm-hmm.
clinical system is not doing its job, that's going to affect the front office system, that's going to affect the hiring, that's going to affect, it all affects one another.
Mm-hmm. Yeah.
Now,
Yeah.
I will say that we don't involve our clinical department in the business operations. So they know that they're connected, but they don't know how to run the business or anything
Mm-hmm.
about that side. I do believe in keeping that completely separate.
Right. Right. Yeah. Yeah. I like that idea about the departments. So
Mm-hmm.
yeah. So wow. Kasey, we've got to hang out again. I know I've got to make a trip to Kentucky here before long, and I'd love to do is just bring my whole team up there and let them see how you guys are doing what you're doing, because it's just
Anytime.
amazing. It's amazing. It's amazing.
Anytime. We'd love to
Yeah.
have you. We like
Yeah.
company.
Yeah. To be respectful of your time, Kasey, tell folks about where they can find out more about the book and the title again, and just more about how they can get in touch with you.
Cool. The title of the book is Fix This Next for Healthcare Providers. There is an entire landing page. Oh, actually, there's two on my website. It's just KaseyCompton.com. And if you add /FTN, you'll find information about getting on the list for updates on the book. You can pre-order signed copies of the book right now. We're not like on a big push for that at the moment, but you can do it. If you opt into the list to get updates, we are going to be building a launch team. These are going to be people that are willing to read the book, are willing to take a picture of the book on social media. And in return, we're going to send them a launch kit that's going to have lots of cool freebies and stuff in there. So if anyone wants to do that, just opt in on that page. And follow us on social media.
Mm-hmm.
Everything we do, we try to post on social media and keep everybody updated. The book officially launches July 19th of this year, 2021. So
Wow.
it will not be long.
Yeah, yeah, it'll get here before we know it. And we'll have, of course, links in the show notes and show summary for all of this, and to get how to get in touch with Kasey. Yeah, it's just I've kind of watched Kasey from the very beginning, and so we've had kind of parallel journeys with this whole consulting bit and all of that, and so it's
Mm-hmm.
been great to be that. And I just like hanging out with Trevor. I mean, that's just yeah. So
People, they just use me to get to Trevor. That's
yeah,
it.
yeah,
He's
I know.
definitely the social one of the two of us.
Yeah. So, well, folks, yeah. And Kasey, thanks for joining me. And let's do this again before long and do some more
Sounds good.
collaborating on stuff. So, again, check it out, KaseyCompton.com, and also in social media, and there'll be links below for you to get to that. Well, I can't wait for the book Fix This Next for Healthcare to come out. I'm so glad that you got to hear my conversation with Kasey. She is a brilliant person. She is just has the knack for putting things together and really thinking through things in detail and knowing how to create a well-oiled machine when it comes to our practices. And I can't think of a better person for you to learn from when it comes to systems and processes. I mean, she's kind of my go-to person when I think about learning some new ways of creating, a practice that runs well and that your clients are happy, your patients are happy, all of that she has done. She knows how to do it. So be sure and check it out. Again, there are links in the show notes and the show summary here, but her website is KaseyCompton.com. And so be sure and check that out. Also, be sure and check out the landing page I created for the Full Focus Planner, and that's at practiceoftherapy.com/Full Focus Planner. And I just invite you to go check it out. I think it might be, you talk about systems and processes. This is a great system and process to keep you on track with your productivity and your time management. It's something I use every single day, every week, and it's like my second brain. So be sure and check it out. Also, be sure and check out I'm about to say it wrong again, the Google Workspace for Therapists course. And again, you can get to that at practiceoftherapy.com/G Suite course, but the name has changed. So it's Google Workspace for Therapists. And if you want to learn some more systems and processes you can put in place, I know that Kasey uses Google Workspace in her practice as well for a lot of her stuff and her dashboard. So anyway, be sure and check that out. And also be sure to visit our sponsor for the podcast, Therapynotes.com. They're the leading electronic health record system for mental health providers in private practice. They have a support network that is second to none. They also have a patient portal that is just so great to have, and that's what is one of those portals that we use every single day with our intakes and getting our new clients onboarded with our practice. They also have scheduling reminders and all of that sort of thing. So it's an all-in-one platform for managing the patient side, the clinical side of your practice. They also do insurance claims, so that is a great place to look. Therapynotes.com, and be sure and use the promo code. I'm sorry, had just kind of a brain blank there. Use the promo code Gordon, just GORDON, and you can get 2 months of their services for free. So thanks again for joining me for the podcast. Be sure and subscribe to the podcast wherever you might be listening to it. And also leave us a rating and a review. Love getting honest feedback about the podcast. And I'm glad you're with me on this journey. And I hope you'll come back for more and tune in each week as we continue on this journey. So take care, folks. You have been listening to the Practice of Therapy podcast with Gordon Brewer. Please visit us at practiceoftherapy.com for more information, resources, and tools to help you in starting, building, and growing your private practice. And if you haven't done so already, please sign up to receive the free private practice startup guide at practiceoftherapy.com. The information in this podcast is intended to be accurate and authoritative concerning the subject matter covered. It is given with the understanding that neither the hosts, guests, or producers are rendering legal, accounting, or clinical advice. If you need a professional, you should find the right person for that.